We never fully know where life is going to take us, and our next guest is definitely proof of that. We've got Eric Grimminger. He is the CEO of ERP Health. Welcome.
Thank you so much for having me. It's wonderful to be here.
So, your story is remarkable. So, just tell us how, or I guess, really what the inspiration was behind ERP Health and how it all works.
Yeah, so the inspiration behind ERP Health in large part is based on my own story. Uh, just celebrated 11 years in recovery, but up until that point, I struggled really bad for close to a decade with drug and alcohol abuse. I finally hit a bottom on August 4th, 2010. I ended up homeless, and I
Mm.
can remember laying on this bench, just feeling so helpless and so hopeless. And something shifted in me that day, and ever since that moment, I've just been absolutely dedicated to not only helping myself, but to helping as many people as I possibly could. And as my own recovery journey progressed, I went back to school, I became a clinician, and I felt compelled to look back on my own path and ask what went wrong. Because I had gone to a treatment center, and while they were wonderful people, it was one of those one size fits all type programs.
Mm.
Nothing was personalized for me. And I was also dealing with some pretty severe depression and anxiety that went undetected and therefore untreated. So when we were creating ERP Health, we wanted to solve for some of the problems that I had dealt with, but it really works by creating a feedback loop between the patient and the clinician. But our secret sauce, honestly, is we put the power of recovery directly in the patient's hands.
It's interesting because you came up with ERP Health Platform. Of course, it's vital for addiction treatment centers. How did this all come about, and what makes the ERP Health Platform so important for these treatment centers?
Well, the science is very clear. When the patient is involved in the treatment process, it leads to more effective clinical encounters.
Hmm.
The ERP platform engages directly with the patient, and we collect assessments on a weekly basis. And the clinicians at the treatment center using our software are able to use the information collected from the assessments to truly personalize the care experience. Patients deserve to be involved in treatment, but most importantly, they benefit when they're involved in the treatment process.
Hmm. It's great that you have a firsthand experience with this, that you can use that knowledge to help so many other people. What are some of the risks for people in recovery during this pandemic right now? What is it that you're seeing and trying to help with?
Well, the effects of the pandemic on people with substance use disorders and mental health conditions has been catastrophic. In America, it's been reported that there have been over 93,000 overdose deaths in 2020 alone. It's also been said that now 1 in 4 people have been diagnosed with a mental health condition. So more people than ever are seeking treatment. Now, these are our family members. These are our friends. These are members of our community.
Mm.
So the risk is that they seek treatment and they don't get the help that they need. Now, the ERP platform was created to kind of be an indication. If you're looking for treatment and you know that a treatment center is using the ERP software, you know without a shadow of a doubt that they are going to get personalized care to meet their unique needs. I'm very proud of it.
September is National Recovery Month. What message do you have for people in recovery?
Well, I would tell people stay connected to your resources. Recovery begins really when you leave the treatment center. That's kind of when a lot of the work begins. And I'll let you in on an exclusive.
Okay.
We're actually finishing up an alumni services component to our platform where we're able to empower patients once they leave treatment, staying in touch with them and giving them resources to make sure that they're continuing their recovery. So that would be one thing I'd say, stay connected to your resources. And the second thing I'd say is never give up. Whether it's your first time trying or your 50th time trying, never, ever, ever give up. We do recover.
All right. If people want to get in touch with ERP Health or just learn more about it, how should they access that information? Website?
You just go to our website, erphealth.com.
All right, easy peasy. Eric Grimminger, thank you so much for being with us and sharing your very inspirational story. We appreciate that. And we'll be right back with more Midday Maryland right after this. Stay tuned.